Hi, everyone. I'm Nine Health Volunteer Stephanie Carlson, and I'm joined today by Dr. Eric France. He's the Chief Medical Officer with the Colorado Department of Public Health and Environment. We're going to talk more about the COVID-19 vaccine, booster shots, vaccines for kids, what symptoms you should be looking out for as we enter kind of this enter this respiratory season of respiratory illness. And if you have any questions, you can post those in the comments. We'll get them answered as soon as we can or as best as we can. So welcome, Dr. France. It's great to have you with me.
Thanks, Stephanie. I'm grateful to be here.
Yes. So first, let's talk about booster shots for the COVID-19 vaccine. First, we're hearing a lot about it in the news. Who should get a booster shot?
Well, booster shots are important for people who are at higher risk of getting severe disease. And by that, we mean they might be hospitalized or they may have to be in an ICU or on a ventilator. And we know there are certain groups that are at higher risk. The first is people 65 and older. We've seen waning immunity over the last couple of months after they've gotten their 2 primary shots, and now it's time for them to be boosted. People who are between the ages of 50 and 64 who have certain medical conditions are at higher risk of being hospitalized. So if you have diabetes or asthma or an immune compromised condition, have had a transplant of an organ, the traditional diseases, if you have anything that's a chronic medical condition, you're likely to be at higher risk for severe disease. And if you're 50 and older, you should be vaccinated. And then there's this other group of people 18 to 49 that we say, gee, if you have a medical condition, you might benefit from this. So consider getting the booster shot. And if you're someone who's between 18 and 64, who just is in a lot of contact where there might be COVID disease, you might be a teacher at a school, you might work in a hospital setting, wherever you might be exposed, you're a group that we would say you ought to consider getting vaccinated as well with the booster. The booster seems to improve your antibody levels, and we expect that that leads to better protection in the coming months. And so with winter coming in, it's important that folks get their booster. Of course, what's most important is that if you haven't been vaccinated at all, we'd really like to see you vaccinated. We've got troubling signs right now from our hospitals. There are over 1,000 people in the hospital right now with COVID. The bulge of admissions are people between the ages of 40 and 65 who are not vaccinated. They particularly might have a medical condition like diabetes or high blood pressure or heart disease. And these people have high death rates in the hospital too. More than 10 out of every 100 hospitalized are dying. And so it's important that if you're not vaccinated, if you're between 40 and 65, that you go get vaccinated. Not only so that you don't get COVID, but so that there are enough hospital beds for other medical conditions like needing heart surgery or having a bad pneumonia from something else. We just need to protect and preserve our hospital care system. And the best way to do that is for the unvaccinated to get their shot.
Right. And again, I think we're live on the 9 News Facebook page as well now. I'm Stephanie, I'm with 9 Health, and we're talking with Dr. Eric France. He's the Chief Medical Officer with Colorado Department of Public Health and Environment. We're talking about the COVID-19 vaccine, specifically boosters, additional doses, the vaccine for kids. If you have any questions, you can post those in the comments and I'll get them answered for you. And even after we're live here, you can comment after the fact and we'll try to get those answered for you as well. So you're talking about, who should get a booster dose of the COVID-19 vaccine. When should someone get it? Is there a magic number yet that we know as far as when your immunity starts waning?
Yeah, the recommendation is that if it's been 6 months since you completed your Pfizer vaccine and you're in one of those categories, we recommend that you get a booster shot. Now, there will be new news this week, and of course, that's because we have 2 other vaccines, the Moderna vaccine and the J&J vaccine. And we expect that even by tomorrow evening, as early as tomorrow evening, the FDA will make recommendations for booster shots for persons who received Moderna and J&J as well. And the group of people to be vaccinated with boosters will be the same as what we've been saying for the Pfizer. So good news is that if you've been vaccinated with one of these 3 vaccines, it's been greater than 6 months since you finished the series, then it's time for a booster, and we have lots of places for you to get it.
Yeah, that was going to be one of my other questions too, is I have in-laws, who received the Moderna vaccine and they're in that 65 and over, 60 to 65 kind of group. but can you mix the doses? It doesn't sound like people really have to, if they're approving Moderna and J&J soon, but can you kind of mix and do a Pfizer booster if you had Moderna the first time?
Yeah, that's another piece of review that the FDA is actually just finishing up, which was looking at, can you mix them? If I got Pfizer, can I get the Moderna as my booster? If I got J&J, can I get Pfizer as a booster rather than staying with the same vaccine? And so the FDA was given some data just this last week, and they reviewed it, and it showed that indeed mixing is okay. I think the preference is always to stay with the same vaccine if you can, but mixing is a viable alternative. And it may be too that if you had the J&J vaccine and you had only one, it appears that getting one of the mRNA vaccines, either the Pfizer or the Moderna, may actually boost you more than getting the J&J shot as your booster. So we'll hear more from the FDA in the next couple of days about what they will recommend when it comes to boosters and mixing of boosters. There's another step that will happen too. There's another group called the Advisory Committee on Immunization Practices. They're not with the FDA, they're at the CDC. They'll review this as well, I think Thursday of this week. So really by the end of the week, we should get some clear messaging around who should get boosted, whether we can mix them, and what time intervals is appropriate.
Okay, and I have a personal story to share. So I'm fully vaccinated. I got the Pfizer vaccine. I finished it in April, but then I was one of the unlucky ones and got a breakthrough case of COVID, kind of the first time I even left the house in the last 2 months, I think. I'm trying to think of when I had COVID, but it was recent. Mild, which was great. So I'm thankful I got my vaccine. But I keep saying that kind of served as my booster. Is that true? Like I was fully vaccinated, I got COVID.
Yeah.
Do I need a booster shot still?
Well, that's a great question. Two things there. First, no vaccine is 100% perfect at protecting against an infection. And there are actually many vaccines where really the goal is to protect us all from severe infections. So as an example, we have the chickenpox vaccine that we've been giving to children since 1995. Once you get the chickenpox vaccine, you can still get chickenpox, but it's usually a rather mild disease, but it really protects those children from being hospitalized from chickenpox. And the same thing is true with the rotavirus, which is a diarrhea vaccine that we give to babies. It reduces their chance of getting it, but what it really protects them against is being hospitalized. And that seems to be the pattern that we're seeing with the COVID vaccines. If you get the COVID vaccine, you may break through and get a mild illness, particularly if you're under 50. It's a mild illness, and the chances of being hospitalized with a breakthrough or a repeat infection, if you're under 50, is quite low. But as you get older, these breakthroughs, especially if you have other medical conditions, the breakthroughs may be more serious. So if I get my vaccine and then I get a breakthrough, do I still need the booster, or did the disease serve as a booster? I don't know that it makes sense that they would, and I don't think there's any harm in getting the booster. So if I were you, I would recommend that you get the booster. If anything, you might be even super protected now because you both got the disease and you get the booster.
Yeah, that's what I'm hoping for. So yeah, I don't mind getting another one, but yeah, I thought I would ask that question because both my husband and I have it. We were very curious about that. So we're getting a question about kids. We can kind of move on to that topic. I want to kind of ask the question that we got on the 9 News Facebook page first, and then we'll get into a little bit more about the vaccine for kids. But are kids more at risk for side effects from the vaccine? Because we're getting into that, we're getting close to it being available for that younger age group, 5 to 11. Are kids more at risk of severe side effects?
They don't seem to be at any more risk. Their side effect profile is comparable to the older kids, the 12 to 17-year-olds. The other thing to remember is that the dose will be used for the 5 to the 11-year-olds is actually 1/3 the strength that it is for the older children and adults. And the hope is that it seems to provide good protection, high antibody responses, and it may reduce the number of side effects because it's only 1/3 the strength. So there's nothing pointing to any unusual side effects with the 5 to 11-year-olds getting vaccinated.
In your opinion, it's still worth it to get them vaccinated as instead of not get them vaccinated over fear of those side effects. Yes.
Absolutely, yes. As a pediatrician and a public health doctor and parent, I would recommend that 5 to 11-year-olds be vaccinated. I think there's a few things to think about. One, we want kids in schools. You know, as a pediatrician, we're focused as much on the issues of socialization, the importance of learning, family balance, all that goes with having children in school. And when there's outbreaks in school, that might mean in-person learning is lost and we have to do it at home, and it has a real impact on society. So there's a social issue that's really important as well. There are rare, serious complications from getting COVID as a child. And just like there are rare, serious complications from the flu or from chickenpox, we vaccinate children to protect them against these rare, serious side effects from catching the natural disease. With COVID, there is this thing called MIS-C, multi-system inflammation syndrome of children, which puts children in the ICU. It's rare, maybe once in every 1,000 to 3,000 cases of COVID, but if we can protect children from getting that, it's to our advantage. So I do recommend that we vaccinate our 5 to 11-year-olds, keeps the schools open, protects them from rare diseases, and it protects folks at the house, you know, grandparents and other parents from catching COVID. A child who has COVID can spread it to other household members.
Right. And so I'm a mom of a 5, almost 6-year-old, anxiously awaiting when it'll be available for that age group. What is the update there? When can we anticipate the vaccine for that age group?
We're planning for early November here in Colorado. We know that next Tuesday, October 26th, the FDA Advisory Council will look at the data and make recommendations. And so probably by the first week of November, shipments will start. We've already been asked to put in some of our orders for those shipments. And our hope is that we'll have it in the state by at the latest, the end of that first week, you know, November 5th or 6th, or shortly thereafter. So we're working hard already to connect with all the enrolled providers, whether it's doctors' offices or pharmacies, to make sure that the doses will be well distributed, and those families who want to get their children will have easy access to it.
Yeah, and so speaking of that, you mentioned pharmacies, they're primary care providers. Where can I get, where can we get our kids vaccinated when it is ready and available for them?
It will be the same places that you can get them now: local public health agencies, doctors' offices, pharmacies. We are talking about maybe having some events with some strong partners where you could go to get a vaccine, maybe not quite as big as the community vaccination sites that we were doing this past April, but centers where families can go to see trusted partners and have their questions answered and get their children vaccinated.
And you said
stay tuned, more is coming. Yeah.
And you said a lower dose for this age group, but still 2 doses, correct? They still have to, my 5-year-old would be curious to know, still have to go get 2 pokes.
Yeah,
correct?
So it's the Pfizer vaccine. And for an adult, we get a dose of 30 micrograms. For the child, it's 10 micrograms, and they're separated by 2 weeks. So it will be 2 pokes.
Okay, and before I move on from kids, any update on the even younger age group than 5, those younger than 5?
Yeah, so certainly under than 5, we want to get them vaccinated, and that data is being collected. I expect it sometime early next year that the younger age group, 6 months and above, will be vaccinated.
Right, and so I also want, go ahead, sorry.
I just want to call out, Stephanie, to something you said before. As a pediatrician, I always found it helpful if families told children what to expect, like you were saying. So letting the child know it's going to be 2 shots 3 weeks apart helps them prepare mentally for what's to come. I think that's a great parenting advice that you call out.
Yeah, ever since this all started, he was 4, now 5, going to be 6. He has been very curious about everything that's going on in the world. So we try to keep him, knowledgeable about everything that's going on. He's excited to get his vaccine when it's available. So he always asks, like, when can I get my medicine? When can I get mine? Because he doesn't want to get sick. So that's good. But yeah, he's not super excited about getting 2 shots. He keeps asking, I have to get 2? I have to get 2 of them? Like, it'll be all right. You'll be okay. I wanted to ask you quickly too about just additional doses and the kind of the difference between getting it for, all age groups really, I guess, but getting an additional dose versus what a booster is. So who needs an additional dose of a COVID-19 vaccine? How does that work?
Well, when we started off with these vaccines, we did the work to determine that we think it's a 2-dose series, as you know, one at time 0 and another at 3 weeks for Pfizer or 4 weeks for Moderna. And we called that the primary series, and we thought that was enough. Turns out, though, that if you're an individual who is immune compromised, let's say you had a solid organ transplant or you're getting cancer treatments, the primary series isn't a 2-dose series, but it's actually a 3-dose series. And so persons who have moderate to severe immunocompromised states actually didn't get enough with just the 2. They needed a 3rd. So that provides them with their primary series. Then as time goes forward, if the protections decline over time, we call that waning immunity. And that's where we might say, oh, you need a booster for it to go up. And so now we've been working with these different groups to say, boy, they need a booster. Let's give the right people boosters to protect them and remove the waning immunity issue. I guess the one thing that we're still trying to decide, and it's only through science and it takes a little time, maybe the primary series is 0, 1 month, and 6 months, right? We didn't know that when we started in December, but now we might learn more to say, oh, just like other vaccines, the hepatitis vaccine is a 0, 1, and 6 month schedule. The HPV vaccine is 0, 1, and 6 to 12 months. Maybe the COVID primary series is actually 3 doses spread out over 6 months. You only learn about that through letting the time go by and studying it to decide that's actually what the best schedule will be. So we'll learn more, I think, over the next year about what really constitutes a primary series, additional doses, and needed boosters.
Yeah, it's novel coronavirus, COVID-19. It's new to everyone, including the greatest minds that are kind of working on things. So yeah, we all have to learn. And I got my breakthrough COVID case right at like that 5-6 month mark. So it does make you wonder if that's kind of the schedule that we need for kind of a primary dose of the vaccine. We got another question on the Facebook page about kids in the vaccine, and we did talk a little bit about this, but if you could just answer this again. When approved, how will the vaccine be distributed to that younger age group, those kids?
So you should be able to find it in the community. If you go to the Department of Public Health and Environment website or Google vaccine sites near me, you'll get information about where those are. A lot of our family medicine and pediatrics practices will be offering the vaccine in their clinics. So we're working hard to make sure they're ready. The pharmacies that have been vaccinating, if they're comfortable doing children 5 and above, they will do it as well. Local public health agencies that typically will give immunizations will also be offering it. So many of the same places that we've been offering the vaccine for the last 8 months will be participating in vaccinating the 5 to 11-year-olds.
Great. Yeah, thank you for mentioning that again. I think that's important. Someone did also ask on Facebook some of the COVID vaccine myths. So that's kind of a loaded question, but as a pediatrician, as a doctor with CDPHE, what are some of the more popular, I guess, vaccine myths that you come across that you kind of have to dispel?
Well, I think first and foremost, it's important to recognize that vaccination is more studied than anything else we do as pediatricians, right? So I might prescribe an asthma medicine, I might prescribe a medicine for attention deficit hyperactivity disorder, and I use certain drugs for those conditions. They haven't been nearly as studied as how much we study immunizations. We know we're asking a family with a healthy child to receive a vaccine, so it requires a lot of study to be sure that it's safe. And so with hundreds of millions of doses given, with great tracking systems across the United States and the world, a lot of safety work has been done to identify rare serious complications from being vaccinated. We know if you may have a severe allergy to a component of it, that's rare. A couple people in a million will have that happen. We know that for young men, there's a low risk of a mild inflammation of the heart muscle called myocarditis, causes some chest pain, hospitalization for careful observation, and home in 2 days. No deaths associated with this kind of myocarditis. Those are the main ones. There's all kinds of different rumors out there, and I'm not going to call out anyone specifically, but with the internet and social media, it's easy to say whatever you want. And so I would highly recommend that you speak to a trusted doctor or provider to get your answers to your questions. You can look to the Centers for Disease Control and Prevention for information. Children's Hospital of Philadelphia has a lot of good information on vaccine safety for children and adults. So just look for trusted resources. And if you hear something, have some skepticism in it, because just because you hear it doesn't mean it's true.
Yes, I think that's good advice. Work with your doctor, come up with the best plan for you and your family. I did want to, before I let you go, I wanted to talk a little bit about, we're up, in the flu season as well, cold flu season, RSV in kids. There's a lot of things going around already. This winter, how do we kind of recognize the different symptoms of each and differentiate it from COVID-19?
Yeah, it's a good call out. We're at some risk of having multiple viruses hit us all at the same time. I heard it described as a polyviral disaster. Now, I don't see that happening, but potentially with flu, respiratory syncytial virus, RSV, COVID, could they all hit at the same time? It's really difficult to know the symptoms that you have, which of those viruses might be causing it. So I would recommend getting tested if you have any kind of respiratory symptoms. We have over 125 testing sites free, available across the state. Again, locations posted on our website. And be sure, of course, that you get your flu shot. We had a fabulous flu season last year in some ways. 35 people hospitalized in the state with flu. We usually have, over 3,000 people hospitalized each year with flu. We just didn't have it. We didn't have a lot of RSV last year, which is a pediatric virus. It's now been raising its head in July, August, and September. And as people get together again and connect with each other, they're going to spread respiratory illnesses. So all those practices that we know prevent respiratory illness, get your flu shot, get your COVID shot, wear your mask, wash your hands, stay 6 feet apart, be in well-ventilated areas. We need to practice all of that through the fall and winter so that we really minimize the chance of overwhelming our hospitals. That's my biggest concern these days, is really about our hospital systems, and are we doing everything we can? They've had a disastrous 8 weeks when it comes to staffing, people retiring, not enough nurses, having to cancel surgical rooms because there aren't enough staff. And now you throw COVID cases in the mix, and it's really tough on our hospitals. That machine of healthcare has been running hot for many months, and it needs some attention and repair. And if we can minimize the number of people coming into it by getting vaccinated, that'll let us cool things off and manage our healthcare system.
Right. And if you still need a COVID-19 vaccine, you still need a flu vaccine, you can get those at the 9 Health Fair that are running this fall. 9 Health 365, they have, I think, 3 more fairs coming up. You can go to 9health365.org and find those last few fairs. You can go there and get vaccinated for free, along with getting preventive blood work, getting some other free health screenings. So it's nice that those fairs came back for this fall. But also just work with your doctor and come up with the best vaccination plan for you with flu, with COVID, all the things that'll be going around. I want to thank you so much for joining me. If anyone has any additional questions, you can still post those in the comments even after this live is done, and we'll get them answered for you. And yeah, I just wanted to say thanks for joining me. And yeah, that's kind of it here, unless Dr. Vance has anything else you'd like to add.
No, thank you, Stephanie, and thanks everybody in Colorado. We've got over 3.8 million of us who've been vaccinated. If you're still waiting to get vaccinated, please talk to your doctor or trusted care provider, and please get vaccinated so that we can return to our normal lives as fast as possible.
Yeah, thank you so much.
Thank you. Bye-bye.